You're welcome to today's episode of Raising Healthy Kids with Dr. Bumz. I am Dr. Bumi Fakeye Udogo. And today, we'll be talking about an important event that happens and that every parent looks forward to in the child's development. You know, it's an important milestone that is usually eagerly awaited, and it's a bit confusing because symptoms will show up, much earlier than the event happens. And then quite a number of parents are confused and say, but the child was demonstrating the signs a few months ago. Why has this event not happened? You want to know what event we're talking about, right? Okay. We'll be talking about tooth eruption, or what we can also call teething. And let's define it briefly by saying that it's a natural way of eruption of the primary teeth through the gum, and this usually begins at about the age of 5 to 6 months. However, a child would have demonstrated some symptoms that we call teething syndrome at about the age of 3 months. And that's what brings about the confusion for parents, because when they observe those signs, they think that, my child's teeth is coming out very soon, and only for there to get to 1 month and 2 months after, and then they're still looking for the teeth and not finding it. Don't worry, there's nothing wrong about that. It's just the normal teething syndrome that's occurring. Now, teething, like I said, happens at about 5 to 6 months. And there are some signs that usually manifest at about the time of teething to indicate that teething is about to happen. There are specific and some are non-specific symptoms. When you notice things like drooling, the child trying to chew on a hard substance, for example, taking your finger to his or her mouth, chewing on your phone and drooling all over, soreness of gum, redness of the gums, and rash sometimes around the mouth. Those are some specific symptoms that usually herald the process of teething. Some non-specific symptoms may be that the child's body temperature is a bit warmer, so the child feels warmer than usual. The child can be a bit irritable or restless, could have poor appetite because of the irritation in the gum area. Some children may even have cough or runny nose. But sometimes most of these non-specific symptoms tend to be coincidental findings. They are not particularly directly related to teething. And also at about that age range, the child's immunity starts to become low. As infants are exploring, some of them have started crawling, they're putting their fingers and other objects into their mouths. It tends to predispose them as well to infectious diseases, especially viral infections. And that could also be responsible for some of these non-specific symptoms that we talked about: mild fever, cough, runny nose, irritability, and things like that. There are some challenges that would happen or that could occur with tooth eruption. Tooth eruption could be delayed. Many a times, some parents, when they notice some of the symptoms that I highlighted in the child, they just tend to attribute it to teething and do nothing. But please, just to sound a note of caution, that you should not overlook serious systemic disturbances by just attributing the symptoms to teething. Alright? Now we know also that some parents usually want to be quick to get teething mixtures and teething products that will help to relieve symptoms and all. But quite a number of studies have shown that some of these teething mixtures are actually not only not beneficial to your child and to the teething process. Remember that the teething process is purely physiologic. It's a natural process and it happens usually without serious symptoms. So you really need to be sure not to use or not to feel the need to use some of these teething mixtures. Some of them have high doses and high contents of sucrose, which is as good as table sugar. And you can imagine giving your child so much of sugar at that tender infancy age. Some of them even have alcohol in them. And alcohol is not actually good in the child's system, especially for brain growth. Some of them have anesthetic agents in them. Some of them have hypnotics and sedatives. So generally, we do not advise the use of teething mixtures or teething products when you notice teething signs in your child. However, if your child really has serious symptoms, it is better that the child is evaluated in the hospital, evaluated by the child's pediatrician or by the healthcare practitioner to know if there is any concurrent infection ongoing that needs to be addressed. There are some challenges that could happen with tooth eruption. There could be delay in tooth eruption. However, we usually would wait until age 12 to 13 months. That's about the age of 1 year, when there has not been any sign of tooth eruption or the child has not had any symptoms of it. That way your child requires thorough evaluation to know what could be the cause of this delay. And then some other conditions arise in the course of tooth eruption, like multiple teeth or ectopic teeth that is in a place where it's not supposed to be. Some of those things are better addressed by the healthcare practitioner, and your child's pediatrician will give a good guide as to what to do. Sometimes tooth eruption could come too early. When a newborn is delivered and you see tooth on the gum already, or within the first month of life, you already notice that your child has tooth. These are called natal and neonatal teeth, respectively. They are actually too early and they may cause issues with your newborn baby because they may get dislodged and your child may aspirate or swallow the solid tooth that is not supposed to be swallowed or aspirated, and this could cause issues. So usually when this is noticed, when teeth is noticed too early, it is better that the pediatrician helps to sort out your baby. While the tooth eruption is happening, you need to remember to please ensure good and safe cleaning practices of your child's mouth and the gum area, the tongue, and even the teeth that are already erupting. Okay, you can also give or use tooth eruption friendly teething toys for the child. Remember that I said they want to usually chew on hard things. So there are some teething rings that are readily available that are safe. Just make sure it's the safe one. When you are thinking that your child is in pain because of tooth eruption, you can give pain relief like paracetamol or acetaminophen or ibuprofen just for a day or two. And if symptoms do not get relieved, remember to please visit your child's pediatrician. And also you can consult your child's pediatrician at any time during the period of teething. Remember, it's a process and it's a development in your child that everybody looks forward to, and it's not a time to make your child ill. So don't assume that your child is just teething when your child has some other symptoms. Bring your child to the hospital, let the child be evaluated thoroughly, and let us know. If you have any further questions or clarifications, send a DM or send an email, and we'll be right back to give you the answers that best works for you. You're welcome to the question and answer segment. Easing teething discomfort. You actually need to be sure that the child is actually uncomfortable. Sometimes the child is in pain. You can give some pain relief for a day or two and then watch. You can also get the safe teething toys like teething rings, teething keys. They have their names. They're not too soft and they're not too small for the child to coincidentally, unfortunately, aspirate or swallow. So those things can be soothing at the point in time when your child feels some discomfort. Remember also that anything you're giving the child to put in the mouth should be as clean as possible, and if it's possible, especially with the toys, you can sterilize them from time to time when you are giving your child to use. Definitely, teething can affect your baby's sleep. It's not all the time. It's a generally natural process. So if a child is perfectly okay while teething, you need not worry. But for those ones that experience some discomfort, it may actually disturb their sleep. They may be irritable, they may be restless. Just make sure to nurse your child, feed your child very well, put your baby to breast, rock your baby to sleep, and feel your comfort in your arms, and that should really help. First and foremost, please try to stay off teething mixtures. Aside from these teething mixtures and products, whatever food you have been giving your child, you can continue. You do not need to withhold any particular food that you are already giving your child. If your child is still being breastfed, continue breastfeeding. Breastfeeding will not harm your child who is teething. And if your child is on follow-on milk or cereals or pap or modified family diet, you can continue the feeding as you were doing before. No, not at all. This is absolutely dangerous for your child. Please do not do that. No, your child doesn't always have to have a problem for something not to happen at the time maybe most other children's teething happens. Drooling is not because of worms, please. Oh my God. No, please. It's a process, it will happen. As long as it starts, it continues to go through the process, and until the process is complete, you don't need to fast it, you don't need to fast track, it just happens. I totally enjoyed this episode. I hope you did as well. Until the next episode, remember to like, to follow, and share with your friends and family. And you can send us a DM, send us an email. Remember also to turn on your notification button so that you know when the next episode drops. Until then, I remain your one and only Dr. Bumz. Bye!